All right, so having a band is a good way to like start a strength session. If you don't want to go through like a full warm-up just for a leg session or something, just hit some bands or whatever and it'll be good, okay? I've got a lacrosse ball and I've got a softball. These two things can like hit the majority of stuff, okay? The reason why it's two of one of a different size is because if I do something like on my lower leg, I'm gonna want that, so it's a smaller muscle, like the ball's not disappearing in there, I can do some things in there, okay? If I do this, I can't put enough. This is what they call like broad contact in like a massage realm. They call this a broad contact, okay? Sometimes you want, generally to change tissue, you want less of a broad contact and more of a like finer sort of detailed point of contact, okay? But if I put this in my hamstring, it's just gone, disappeared, right? So if I'm trying to do like some hamstring active release, kind of like floss things out, right? Its ball's disappeared, it's nothing. So that's when I'd use like a bigger ball on some of those bigger muscles where if I put this in my hip, it's just gone. Okay, between the chair and the hip, everything's gone. So just having those two tools is great. I'll get into some floss and other stuff later. Who has one of these? I've seen a lot of people with some scrapies. Cool. Tell me how you use this, dude.
Mostly on my calves.
Yeah, but like how?
What do you mean?
How do you, like, show me how you would use it. And you can come up here if you want. No pressure.
Yeah, like that.
Okay, cool. Okay, great.
Good.
So guys, the technique, this is important with this stuff. There's a technique, this is one of the few things where like technique actually matters in regards to like soft tissue work, okay? Is when you have the squat shot tools. This can be like a pro, or this can also like set you back and not make you feel good, okay? This is not a hard, like ruthless scraping, okay? What you're trying to do here, the main function of this is blood flow to an area where you may not get a ton of blood flow. So you're talking about like these little grooves in the calves and the Achilles, you're talking about around the ankles, between the bones, right? Like around the ankles, you have bands of ligaments called like retinaculum, right? Like to get blood into those sort of things, this is grateful. What this is not doing is to just like change the interior of your body, okay? This is not a deep tool. This is a superficial tool for blood flow mainly, and if you do it correctly, it can have some of those, it can break up some of those adhesions and like sticky surfaces between the skin and the muscle, something like a tendon, but that's really it. We're not like going deep with this. The appropriate style of this is you don't have to, you don't have to. This is what I do. You have to have tension, like it has to be sort of stiff, okay? And you're just giving short little scrapes that look like this. You shouldn't see like big red cherries. Who's done it like that? Where you like, yeah, you just get into it. Not the purpose of the tool, okay? So that's like really the only like finer detail. For the rest of these, like I say, you need time and you need a lot of force, okay? Because our body is super, super durable. And we put force into it. We put so much force into it. And we have to replicate that sort of force when we change something. So we can change tissue. It just has to be, you have to put time into it. You have to be intentional about the positioning, where you're feeling it, and you have to put force. So like, for instance, when you're doing something, rolling on a foam roller on your quad is like, we're not doing a lot. We're bringing maybe a little bit of, like that, that's yours, Jimmy, or Ben's?
One room is mine.
Yeah. We're not doing a lot there. Like we're bringing a little bit of blood flow into there, and that's great. If there's positives to that. But like, if you have a tight spot, are you releasing it with that orange foam roller? Definitely not. Okay? What that's for something like this, getting into the spot, giving it weight, and just repping it out, right? Finding those positions, like we're talking about like actually changing the function of a muscle. We're not talking about just like playing around on it, okay? So why don't we, guys, just have some space in between. What we're gonna go through is we're gonna go through just a easy check that you could do at the beginning of the day, let's say, to see how your body is feeling that day, okay? So just spread out so you have some space. All right, so let's just make sure, let's just wake up, we just check the hips. When we go through this stuff, this is not about like range of motion, this is not about setting a new record, this is not about how deep the person next to you can go. This is just about checking some of the ends of the range of motion. Do they move smoothly? Am I having an issue just like turning like this? It's a pretty good sign, right? So let's just check that. So we're gonna do 90-90, all right? We don't have to do no hands or anything like this. Feels all right here. Do I have any motion here? Like there's no restriction here. Look, I'm not even stretching. I'm just feeling this position, okay? So right now all we've done here, we've turned this leg, this femur, into internal rotation, and this one into external rotation. That's all we've done. Doesn't matter how you switch, you don't have to do no hands or anything like that. Just get in the other position. Okay. Does it feel different? Raise your hand if this feels different, this side. Yeah. Sweet. Guys, well done. You just decided, you just figured out that you have an imbalance in internal and external rotation, okay? Which is like a huge thing. That could be, it's not a big deal, it's just a huge thing to figure out by yourself, right? So like if you're here and you realize that this back leg just does not feel right, like there's something, like something's like blocking it, okay? Then you just figured out that like your internal rotation on your left side is not great. Like it's different. Doesn't mean it's bad, it's just different. And if you feel like, you're like, oh, that kind of makes sense, like my left knee's been hurting. Then we start to pick things up, okay? So, for instance, I'm just running through these are general scenarios. So let's work, while I show you this, let's just work back and forth and just see. In a minute, I'm gonna ask you all right, did anyone notice restrictions and all that stuff, okay? So as a person that I'm assessing, I woke up, I'm assessed, I'm like, something's not right there. Keep going, keep rotating through. Then I'm going to look at that leg and I'm going to look in the hip with this softball, right? And I'm just going to feel and be like, what is going on in here that I can't turn my hip? That's crazy. So we look around, we feel something. If you feel something, you sort of scrub it, right? We can bring the knee in and out. This is not comfortable. That's not the goal of this session. The session is can I identify something? Now can I just make it feel 10% better? Okay? That's the goal here. So we get in that hip and then we see, and we spend minutes in that hip, couple minutes, and then we see, we're like, okay, does it feel any different? And you're like, okay, yeah, it feels a little bit different, but it feels kind of on the inside. And then we look again, we get the ball, we get on the chair, or we get the ball under here, and we start thinking okay, is there something in here that's blocking? All right? So that's how you assess something. And this is just when I send you guys mobility stuff, because it's remote and because you guys don't necessarily, I'm trying to teach you the skill of body maintenance, okay? So there's the circuit there, but the ultimate goal here is that you learn 50 techniques that help you. And then while you're assessing your body, you figure out where it is, the tool that's in the chest and the technique that will help you. You grab that and you make huge change immediately, and then you retest. That's the ultimate goal, right? So it's not about doing the circuit, the mobility circuit that I give you. It's about finding that's just kind of a guideline of hey, do this and check out and let me know what you're feeling. But the ultimate goal is that you guys get good at this yourself, because now we're talking about longevity, talking about avoiding injuries, all that stuff, okay? So when I wake up, I might check that. I might sit on my knees. I might just see, if you can't sit on your knees, same thing. You're just okay, where am I blocked? Can I not sit back, right? I might tuck my feet under. figure out like, okay, how is everything feeling back here? Like, where am I feeling that I'm not moving well or efficiently, or tissues, okay? Everyone stand up. So there's a portion where we're assessing, there's a portion where we're correcting. If we find like something in a joint that's stuck, you know, whether it's looking at like hip impingement or we're just looking at like super tight muscles around that joint, there's techniques to fix that, like a distraction technique or a mulligan technique, which I would use a band for, and that's a little complex. I won't go into that today, but like there's a lot of stuff in there that you can fix a lot of hip impingement stuff with the distraction techniques. All right. Then I'll start looking at, you know, the rest of the system. So, you know, I can get down here obviously, but like what I want you to do is just find a spot where we can start working through what's called an elephant walk. Okay, and again, we're not setting records, we're just trying to find what's different. Okay, so we're down here, you can be here, you can be here, whatever you need. The goal is the baseline is both bent knees, and then you're straightening one knee while the other one is staying bent. So the base position is bent knees, not straight knees. Okay, and then we're just working through one or the other. Just trying to figure out, like, where do I feel blocked? Is something unnecessarily tight? When we look at tightness, a very important factor is it unilateral or is it bilateral? If it's on both sides, we're just looking at, okay, these are just sore muscles. They've been used a lot, and that's okay. If it's one side significantly different than the other side, then we're probably talking about some sort of imbalance or like just difference in how that tissue's working or just, you know, just overall function. Okay, so I get down here and I kind of figure it out. All right. Then, if I want just like an entire sort of flow that we go through the body, and you guys please join me on this, okay? So we're just gonna figure. The hips are the biggest movers. A lot of the problems start here that we see, like that we see kind of in the ankles. It's all. A lot of it is like, you know, starts at the hips. Some of it starts at the ankles, but I like to make sure that the hips are working fine, all right? So let's come down right here. Okay, you're just gonna go hand to the outside. You can stay here for as long as you want. You can decide if something's stuck. You can decide if something like feels really good, if something feels kind of like loose, like you have no control over it, all right? You might work here, you might work out of this a little bit, back and forth. You might do this for, you know, a couple minutes because there's no structure to it. All we're doing is we're feeling a movement and we're moving out, in and out of that movement. It's not about how big the movement is. It's about the fact that we know our healthy range for the day. If you want more range, we can always get one of the tools. But it's just good to know, like, I probably shouldn't do a speed day today. Like, this thing is a little bit rough. You know what I mean? That's like important knowledge. Okay, so we can go through and we can switch it. Notice, like, knees on the ground. It's not about huge ranges of motion. Okay, we just like feeling it. We're sort of in and out of things. Right? You can do knee off the ground. Allow the hips to drop. Just whatever it takes. Move through these positions for like a couple more minutes each leg, okay? So like as runners, we like to stay in this tight little runner niche of movement, like right here. Everything's right here. But when we're doing mobility stuff, it's okay to like come out of that like strict sort of running style movement. You can go into a full yoga flow, right? And like not even reference running in your life, and it's gonna help you. So it's like when we're in these sort of tight structured movements like a cyclist and then just like a closed loop for 7 hours, right? It's okay for him to get some mobility outside of that loop. In fact, what we're always looking for as athletes is not the fact that we have to land perfectly to perform high or avoid injury. The ideal thing that we need to be able to do is land with a certain range of with like a range of error that we can function within without getting injured. If the range for error is like barely outside of perfect movement, you're going to get injured more. If we can create a little bit more room on the outside, then all of a sudden you can take a weird step and you don't turn your ankle, right? And that's now we're talking about body resilience and openness and like being able to just like not land perfectly and be okay. All right? Does anyone have any questions about that? Okay, so if I were to find something here, a spot that I don't like when I'm going through all this, all right, or I'm like, oh, this is just significantly like more sticky, tighter than the other side. Then you have to have the tool to address it. Okay, so you get something, you get one of the balls, you get it on that spot. Now there's a couple techniques I want to take you guys through when I talk about soft tissue work. Okay, there's like scrubbing, which you're talking about sort of, it's generally laterally, and what you're trying to do is like create less of a dependence between the two muscles, all right? Or let's say these are all muscles. If this one's injured, you don't want the other three to be completely like tied to this. You want things to be able to function independently and give that injured or give that tight part of something, give that a little bit more slack so that it can heal while we still go through movements. Okay? Because the important part, if you're very good at mobility and you're very good at soft tissue and body maintenance, a lot of the time you should be able to continue to move, whether it's cross-training or running, through like the recovery of an injury. It's not like, hey, nothing until it's completely fixed. If we're doing these tools right, we should be able to move through injury as we come back in little grades, little steps. Okay? So I didn't like the spot that I found, so I'm gonna get on it. Okay, actually I'll probably use a softball for this one. Deep way. There's a time for that, right? But it's stretching mobility is a little bit different. Like that has its huge benefits. But sometimes we don't have to go that deep. We just need to we just need to open things up just a little bit. Not everything is about perfect optimal. Sometimes it's just do the thing. Okay, so everyone stand up. So this is light work, easy sort of sun salutation, okay? So just follow me. You ready? All right. Stay on lane 1. So if you don't mind, yeah. All right. Inhale, arms up. Big inhale. Exhale down, wherever you got. Inhale, come up with a flat back. Exhale, come down, however you want to. Come in a plank position. Okay? And there's things in here you can skip, there's if you want to, and there's things you can bring it back to, okay? Big inhale, chest to the ground. Exhale, so like downward dog, okay? Okay, big breath here. Bring your foot between your hands. Okay, inhale up. And everyone that I've worked with this week has been in this position a lot. Straight back leg is crucial to running, okay? If we can't even like extend our back leg, we're just fighting your quad the whole time. It's a huge amount of effort, okay? Raise your hand if you're not stable in this position. Some of you guys are. Some of you guys are a little overconfident here, okay? This should be a super stable position. This is a running reference position. Okay, so movements have different archetypes. For running, the positional sort of archetype is a lunge position. All right? Okay, let's go. Big inhale. You're gonna turn your back foot. You're gonna turn your hips. You're gonna exhale. Stay tall here. Okay? You're kind of reaching back with the back arm here. Okay? Inhale down the back leg, or however that looks. Exhale. You can bring elbow here or over. Okay, but the goal here, look at my torso. Watch how much it changes when I take my arm somewhere different. Nothing, right? We don't want to be here and just be lazy. Okay, inhale, arm reach to the sky, straighten your front leg. Exhale, we're coming straight front leg, and just put your hand wherever you're cool with. The goal again, watch my hand, watch my torso. Nothing's different. These are all active positions. This is not get to position and turn body off. Okay? Okay, inhale, turn up. Okay, find your way back to that plank position. Okay, big inhale. Intra-abdominal pressure we've been working on. Downward dog. Exhale. Other foot forward. Okay, inhale up. Find it. Strong. What did someone I worked with in the last couple of days, tell me what's important about this lunge position.
Tension.
Tension. Where tension?
Hamstring.
Hamstring tension in a flex knee. Crucial. Okay? Inhale, turn your back foot. Stay right there. Stay where you are. Got him. Solid. Solid. Nice, dude. You ready for the attack? Good. Okay, so we're solid, guys. Any position we're in, it just doesn't we're not getting here to see how much we can relax. We're getting here to see what are the range of motion I can control my body in. Not just what are the range of motion I can just flop into, okay? So we're right here. Reach up to the sky, straighten front leg. Big tension. Torso, no change in the torso. Breathe. Someone asked me today if you can be relaxed with tension. Yes. Breathing with tension in your body. So you can still breathe, and if I come and attack you, I'm not going to push you over. Right? Okay, inhale back. Exhale, come down and through. Find your way to plank position. Okay? A big inhale, we're going back to downward dog. Exhale into it. Just stay here a little bit. Okay, bring your knees to the ground. Tuck your toes. If this is where you have to be, that's okay. Okay? But I want your toes tucked. Okay, and we're just gonna spend a second with your toes tucked under. Good job, you hid the discomfort at the beginning. Well done.
It's the knees.
Oh yeah, true. Okay, guys, so spending time in this position is pretty, this is a very helpful position. Okay, doesn't have to be forever. Doesn't have to be long term. Doesn't have to be have to push it to the end. It's just it's just giving your toes time to this is the position we have full power out of, is the ball of the foot on the ground with the toes are up, okay? This is the position we push off, right here. That's full. If you ever done work on a sled, right? The final push off position is that right there. If your toes are so tight that you can't even get into this position to push off, then we start looking at lower leg, plantar fascia, all that stuff, because we're not giving anything else a break. Your foot's like a brick. And everything that's from the toes to the ankle is all you can move, okay? So we need to be able to put force through the base of the toes. And we talked about a little bit about that today and yesterday with that mid-foot stability, okay? Guys, stand up for a second. Let me just take you through this for a second. A good guide on if we're all working well is to check stability. The lunge position's a good guide, okay? Another good guide is just standing on one leg. Rachel has a whole video about it, okay? And then another position is, can I have mid-foot stability, which is putting the base of the toes onto the ground and allowing your body you have to stabilize through the foot without the use of your toes, okay? And the base of the toes can put a lot of pressure onto the ground, Okay, now we're talking about midfoot stability. If you ever wonder why your ankles feel like all wonky, but like you're in super shoes all the time and all that, you're probably missing out on some midfoot stability. Okay? Just keep lane one clear, sorry dude. We don't want to be just like grabbing the toes just to hold on for dear life, okay? So this is a check. This is also like something we can work on, but this is a check. Am I do I have midfoot stability today? Because this is going to play a big part in what I do that day, right? A lot of the time, if you find yourself overtrained, central nervous system is a little bit, finding it, when you have keep working on it while I talk, of our minds, balance is a great way to figure that out, okay? I mean, obviously you have to have a baseline. You have to have, if you haven't practiced this, then you don't know if you're good or bad at it usually, okay? If you have a baseline, you've been assessing your body, then you can figure out, you can say, okay, I can hold on to that position, If you can do that stuff, you're pretty primed up for the day. If you haven't not been sleeping well, I bet you your balance is off. Okay, I can almost guarantee it. So it's just stuff you have to know, take into account, but you can only get it if you assess your body, all right? Okay, couple more positions and we'll be done. Let's look at this position right here. All right. So this is an easy position where we can look at a lot of runners get super tight here, okay? We don't have to not get tight there. That's not the goal. The goal is though, but can I is it so tight that I can't even move in a healthy way? Am I just blocked one way? Or maybe one way I can get nice this way, and then the other way I have to turn and my ankle can't stay on the ground or whatever it is. And that's just assessing and figuring out an imbalance, right? So when we go through, we don't have to have feet straight. The feet can go out a little bit, but we don't want to use that as a crutch, okay? Whenever we go knee over toe, we always drive that knee kind of goes third toe out. It's really just about seeing oh, well, this ankle is not working right, okay? And then we just address it. So I know that if I go here, I feel that this part of my soleus right here is I can get through it, but it's not injured. I can just feel that I'm it's tighter than I want, right? So then we can get something like one of the tools to do some sort of active release, put it under some load, really apply some pressure to it, try and get it to move, okay? Some of my favorite techniques, which guys, techniques for this stuff have been around for millennia. This is not new stuff. Majority of stuff is not new, okay? The majority of people talking about this didn't come up with this stuff. What is important is the stuff is how can I teach you to ingrain this into your life? That's the important skill, because most people not only don't know this, but most people don't know how this stuff here can make you almost unbreakable. You just have to stay on top of it, and you just have to assess your body and work it, okay? So if I see something here that I don't like, I might get into it. I might give it some active release and just put it through, pretty significant amount of reps here, 50 to 100 reps of doing it. You do 100 reps of that or to any body part, it's going to be hard for it not to feel different, okay? So we're going through here, we're just kind of figuring stuff out, right? We're seeing do we have a blockage here? Can we sort of get down? Again, not about range of motion, it's about control. Can you stay in control in a bigger range of motion? Just room for error. That's what mobility is. We're creating a little bit of room for error. So every time we take a wrong step, we don't just get injured immediately. Anyone got any questions about that? Okay? Let me take you through a couple things, couple rotational things. All right? And then we'll be done. I'll take some requests to see hey, this thing gets tight. Can you show me a mobility movement for that? Okay? So let's go on our back. Okay, the easiest one to implement is just can I rotate around the spine, right? Easy. So we just go around. Not trying to set any records. We're just feeling our way through these motions. Is there a part of the motion where you just like, your body just says, nope. Nice work. Okay, sit up. Another one, just cross. Again, not about big motion. We just watch this move, guys. This is like the majority of the end of movements here. It's not about seeing how hard we can do it or seeing how far. It's the difference between being here and being here. Okay? Or can I be here and then can I like have a good spine while being here? Okay? Again, this is not forcing stuff. Soft tissue work, we can be challenging to our tissues and like really give it the business. But in this sort of stuff, we just moving through it. Okay? So we just find your limit, or don't find your limit, just find where things are blocked. You can work in and out of it. Alright? So like just going through this, I feel that this is like not as good as my other side. So I don't have to do anything drastic about it. I just have to recognize it. Can I gain like 5% or 10% of function or range of motion with it? Or at least just comfort and fluidity? Okay, it's done already. That took 3 more reps. I would have never known that if I didn't do this. Okay, so then we go back. We pull knee to chest. Okay, this part's super important. Everyone pull their knee to chest. Your knee should come within like at least like 4 inches of your chest, 5 inches of your chest. Okay, great. Now, bring your other knee again. You're bringing your knee to just about the midline of your chest, not to your armpit. Midline of your chest. Then one knee to the midline of your chest, right here. That's to armpit. Guys, watch this. There's a big difference between pulling your knee here and pulling your knee midline. It's like 10 degrees of loading of the hip. Okay, so again, we should be able to go midline like 5 to 6 inches from the chest. And if not, then this is probably something we need to like open up and check into. Okay? All right, good. Do the other leg. Okay, when you're done with that, this last one right here, this one is money. Okay? We're keeping on, the goal here is to keep the knee in the same position when I straighten my leg versus when it's hanging, okay? Don't be ashamed if it's like right here. No one here cares. Okay? You can just put your knee there and straighten. What we're trying to find is a position that you can straighten your leg. When I talk about straightening your leg, I'm saying fully straighten with your foot dorsiflexed. Okay? Come in and out of that. Okay? If you're like struggling to find that position, or you're super struggling to straighten your leg, just bring your knee back a little bit. It's okay. No one here is judging. Okay, so we're moving in and out. You're doing this like, you can do this 20 times and see like how much more comfortable. I mean, we're talking about a clear indication of, hey, when I run, is my one part of my body fighting my other part of my body? Okay, if you can't straighten your leg with your knee in that same spot, then whatever place your knee in, your hamstring is not accessible to that area. So you have no hamstring control at that point because your hamstring is, your quad is fighting your hamstring. Okay, your own body fighting itself. Okay, go to the other leg. Don't start where you ended on the other leg. Start where you began. It's a common trap that I fall into all the time. Flex the foot, work through the entirety. Some of you guys might feel in a hamstring. Some of you guys might be like, oh, my quad is burning. Some of you guys might feel in the calf. Like for me, this is like oddly low on my lower leg, like almost in my ankle. But it just gives me an indication of like where's the spot that needs to be worked. And the goal here is not range of motion. The goal is where can I straighten my leg? Where can my knee be? Maintaining that knee position and straightening your leg. now you have a clear indication of where the range of motion that you have access to. Remember, mobility and flexibility, we're talking about access. Without the ability to control ourselves in a certain position, we've lost access to certain little muscles. Okay? The amount of range of motion we can control through is access to certain musculature, certain functions of muscle, the amount we can open and close a joint. Okay, cool. Anyone have questions? You get here. It's not comfortable on the track, by the way, so don't just cancel that expectation. We put the other foot, we put the sharp part of the bone on the soleus calf, below the calf, right? And you put force into it. And what we're trying to do is we're scrubbing that bone. Not the bone. You're scrubbing that post tib. So you're going to be moving on and off it, and it's going to hurt. It's going to give you a clear indication of where that tightness is coming from. If it's coming from here, this is the move. And most runners, I'd say a good chunk of runners, get post tib stuff. And the complication with post tib, you're like, oh, is it calf? Is it soleus? Is it post tib? Right? A lot of times the soleus, you're like, it's soleus, and it's actually post tib. Okay? What it is not like the main question. How it happened is not the main question. Okay? The main question is like, can I see where it's not functioning? Can I apply a technique to fix it? And then can I improve my movement so I'm moving more fluidly, less jarring, less like forcing things? Is there something in my gait or in my daily life that I can improve that stuff? And those are really the important stuff, okay? Important stuff is like, no, you need to fix it. Whatever you want to call it, it's important to, like, obviously you have to identify it. Whatever you want to call it, as long as you know the spot. You don't have to know the name of it, all right? You just got to find the spot. So when we get to that post-tib stuff, that bone saw is the one, okay? And this, you're doing like 2 to 5 minutes, and you like getting it. This is not a pleasant thing. Like, if you want to actually change your tissues, it's not super fun. Like, I think it's fun because it's like my passion, my hobby. This is not a lot of people's passion and hobby, okay? Like, this is not, it's not fun, but you can identify it. And if you put time in here, like, it will change. You might do this, you might do this twice a day for like 3 days. You might do it once a day after that, and you might just like not have to do it or check it on occasion. These are just tools that we can take out of the toolbox when we think we might need it, okay? Then you put time, force, and like some discomfort, and just commit to it. You make the change, and then we work our way through. A lot of like, there's kind of a thinking in chiropractics where like you should be able to hold on to 50% of the change that you made. So if you make good change, by tomorrow, you should be able to hold on to 50% at least, okay? Otherwise, something's gone, there's only 2 measurements, like did it change or did it not change? And you can, if it didn't, then it's either not enough time, not enough force, or it doesn't need to be changed. Okay, and a good indication when you're doing stuff like this is like when do I stop? Generally, if something hurts and then you start working it and it hurts less, maybe it goes a little bit like numb, and you're like, okay, it's just not changing anymore. Like it did hurt, but now it kind of like feels very different. Then you're fine, and you can just stop. If you're working something and you're like, I don't know if this is doing anything, your body will gives you these subtle clues, and you're like, yeah, it's not really. It doesn't take 30 seconds. It might take you 2 minutes for you to recognize, like, this is not the spot. And that's okay. But, like, you can't just get on it one time and be like, no, because you just don't know. It's just not enough time. You have to do a little bit of investigating. And just to, like, sum all this up, guys, like, these are your bodies. There's no trading bodies. This is it. When you guys in the back, when you guys are, like, 90, same body. You know what I mean? You got to learn to take care of this stuff. Your body needs grace, and we ask so much of our body. Like, I'm in the mountains, I'm jumping up and down things, I'm bombing down hills, I'm lifting heavy weights, I played 10 years of contact sports, I've tried everything, and I'm still here, like, functioning. That's only because this sort of stuff is a huge skill of mine. I've made this a skill. Body maintenance. How do I do something, and if something goes wrong, correct it? How do I prevent something from going wrong? And then how do I come back, either come back from an injury or whatever it is, stay out of the sort of the mental hole, and just like keep going, because staying healthy and not getting injured is the number one performance enhancing drug. Don't get injured. You just do. Imagine if you did something for like 15, 20 years with no injuries, no significant breaks in the cycle. You would be an absolute freak. Okay? Most people don't accomplish their goals because of injury. That's like the number one reason. A lot of the professional athletes or someone who's going for something big, if they're going for the big thing, 90% chance they have the drive until you get to that last maybe 1 or 2%. It's not the drive. It's the injury. They have the drive. I could train all day. I'll just train until I get injured. Okay? So that's not the way. You have to, body maintenance, this is a life skill. When I'm old, I need to be able to know I can fix my body. When I'm young, I need to be able to, this thing is not going to last forever. A lot of the times, the first injury we ever incur is the baseline for a lot of other injuries for the rest of our life. It's like when I have an in-person client, my goal is to reverse engineer someone all the way to the first injury they had. Okay? My first injury was hamstring at full speed, and everything changed from there. Okay? But then as the decades went on, I started to learn, like, no, this is what changed, I can change it back, I need to be confident, boom, 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 it's like 50 steps, okay? And now, I'm not scared of it, I know what I can change. So anyway, this is just a life skill I want you guys to develop. This will keep you mentally and physically well, okay? You guys good with that? All right, thank you so much for your time, guys.